Well, how do we spread the word and the science of gender medicine? We write books, we do public appearances, and we teach. But the most important fundamental contribution that we make is in our financial support through our generous donors of young investigators throughout the world who are doing research on the differences in how men and women experience the same phenomenon. We have young scholars working on sleep disorders, on malignancies, on a whole variety of topics, and devoting their efforts on our behalf to defining the way these diseases affect the sexes differently. Our collaboration through an NIH grant with Johns Hopkins has been one of the most important features of our efforts to support young scholars. Our other major collaboration is with Columbia University's Department of Medicine, where we name one scholar in honor of Dr. Irene Ferrer, who was one of the first women involved in cardiac research at Columbia. Dr. Abdullah, it's a pleasure to welcome you, and we're so proud of your research and your achievement. It's an honor to really support your work. So I am delighted that you're interested in sleep physiology, as I understand it.
That's correct.
Talk to us about that.
Sure. So as a cardiologist, I sort of never learned about sleep. I ended up becoming a hypertension expert, right? At the end of my fellowship, I wanted to really understand why was it that hypertension still is the #1 risk factor worldwide, not just in the US. And so I started doing some epidemiological research in the Jackson Heart Study, which is one of the largest cohorts of African Americans in the world. It's over 5,000 individuals. And through that work, I actually started to understand and look at individuals who had undergone 24-hour ambulatory blood pressure monitoring. Now, as you know, for some individuals, there could be a mismatch between what the doctor takes their blood pressure in the office compared to what's happening outside once they leave the doctor's office.
As patients usually tell me, if I tell them their blood pressure is high,
exactly.
They say it's my fault.
Exactly, right? So I got really fascinated by this, and what I found was astonishing is that 20% of these individuals had actually blood pressure that was higher in their night than during their daytime. So to me it was astounding because also 60% of this cohort were women. And that's really where I started thinking, is there something different in the physiology between men and women? So I actually now are doing a series of studies to understand the sleep physiology of individuals, both with and without hypertension, to really get to the point of understanding what part of the sleep cycle really affects and controls blood pressure. Because once you start understanding that, perhaps we can figure out treatments or maybe even behavioral modifications to help individuals both sleep, but also to control their blood pressure.
Are you looking at the impact of isolation and loneliness on sleep patterns, on people who are suffering from this pandemic?
I'm glad you raised that because there is a difference between before the pandemic and after the pandemic with people's sleep complaints. And over 60% of our healthcare workers reported having difficulty sleeping. Despite being surrounded by colleagues, 71% of our respondents had loneliness. So we understand that loneliness is beyond just being next to someone, right?
It has
it's
to do
that
with
connection.
impotence and
Right.
not being able to control the situation.
Exactly.
Yeah.
Exactly. And so healthcare workers really had to sort of step up and really contribute in a different way than we were usually
Yes.
historically used to.
Yes. Well, what are your aims for the next couple of years? What questions in particular are you going to be trying to answer?
So besides the sex differences and looking at sort of the mechanisms behind how sleep stages and blood pressure are connected, the next phase of my study is actually looking at behavioral intervention with sleep extension and sleep hygiene. Many people in the world, including the US, have difficulties sleeping and suffer from short sleep duration. And that in itself is linked to adverse cardiovascular disease events. And so now I'm focusing on understanding if you modify sleep by using intervention in sleep behavior, can you actually lower and modulate individuals' blood pressure, particularly during the night?
I have to tell you that my interest and the interest of our foundation and your work is so relevant to our purpose. So thank you for accepting the award. We'd like to go forward to continue to support your work, and I hope that you will tell us more about your interests and your achievements as they evolve. You'll hear next from the young people we support with Johns Hopkins about the research that they're doing, why it's important, and how much they appreciate the boost to their careers that the foundation has made, and the senior investigators who help us choose those young people. Johns Hopkins and we are combined in an effort to support research on how the COVID virus affects men and women differently, and we are making 2 extra awards this year to Johns Hopkins to do just that kind of research.
The Johns Hopkins score is transforming our understanding of the role of biological sex, gender, and aging on immune responses to influenza vaccination, which has global public health implications affecting millions of people worldwide. To date, our Career Enhancement Corps, in collaboration with the Foundation for Gender-Specific Medicine, has distributed 7 pilot grants to junior faculty at the Johns Hopkins University, studying sex and gender differences in immunity, autoimmunity, cardiovascular disease, and COVID-19.
We also showcase and highlight the research of our trainees and faculty with topics that represent the translational spectrum of research, from a basic science project on sex differences related to COVID-19 to a clinical research project on cardiovascular disease prevention among high-risk pregnant women, to an implementation science project on increasing access to care for people experiencing intimate partner violence.
My research project focuses on sex differences and the cytokine storm associated with COVID-19 mortality. Studies have indicated that men and women have similar coronavirus infection rates. Nevertheless, men are more likely to suffer severe complications and die from COVID-19 than women. While some studies recognize non-biological factors as potential contributors, for example, hand-washing practices, traveling schedules, and socioeconomic factors, biological sex differences also contribute to this phenomenon. COVID-19 disease severity is associated with high inflammatory cytokine production, an exacerbated immune response commonly referred to as the cytokine storm, which can severely damage the body. By using human bronchoepithelial cells, we are testing the hypothesis that the SARS-CoV-2 related cytokine storm in cells from males is greater than in cells from females.
My research focus encompasses sex differences in cystic fibrosis, commonly referred to as CF. Within CF, research has shown that women have worse respiratory morbidity and mortality compared to men with CF. Thus, there is a need to better understand the underlying biologic mechanisms associated with this sex disparity in order to improve clinical outcomes in women with CF. I hope to provide some of the first combined epidemiologic and biologic data investigating sex hormone levels with respiratory outcomes in women with CF. My overall goal is to become an academic researcher studying the intersection of sex differences in pulmonary disease, and I'm hopeful that this research will allow me to design future multi-site studies and identify potential therapeutic strategies to support personalized medicine within cystic fibrosis.
My research focuses on the intersection between gender-based violence and sexual and reproductive health outcomes. This award funded a mixed methods pilot project focusing on intimate partner violence among pregnant women in Ethiopia and understanding their resource and referral needs. It's embedded within a larger study, Performance Monitoring for Action Ethiopia, a 5-year longitudinal study that collects data on a cohort of approximately 3,000 women at pregnancy, 6 weeks, 6 months, and 1 year postpartum. COVID-19 occurred approximately halfway through completion of 6-week data collection. Thus, it served as a natural experiment for understanding intimate partner violence. Many thanks to the Sadie Score at Johns Hopkins and the Foundation for Gender-Specific Medicine for supporting this actionable work and my very first grant.
We're proud of our young fellows, their enthusiasm, their dedication to their work, their gratitude for your support, all very important to us in our continuing work to develop this science and establish it firmly in the next generation of scholars. Johns Hopkins and Columbia have been major colleagues of ours in helping us achieve that aim.